Hi, my name is Craig Deao. I've been a senior leader with Studergroup for the past decade, where we are committed to helping healthcare delivery organizations engage leaders, physicians, employees, and patients. We believe that is the core competency of the most highly successful care delivery organizations in the country, and we're pleased to be the leaders in helping you achieve this. One of the ways we do this is guided by our engagement model at Studergroup that shows the relationship between this. And I start by explaining this by working from the patient view outward. If you want to create an environment where a patient can engage and can take ownership for their own health outcomes, then we as their care team and partners need to create environments for that to occur. We need to decide to sit instead of stand. We need to decide to let the patient speak for 90 seconds instead of interrupting at the first 17. We need to use teachbacks and assess health literacy rather than assume it. We need to cheer on the small victories of success. We need to help solve barriers together with our patients and family members rather than label patients or explain why it just can't be. And if we want, as leaders, to have our physicians and caregivers have those moments of impact to facilitate patient engagement, then it starts with those of us in leadership positions to create the kind of places to work and practice medicine where the best can do their best. It requires leadership to create environments that engage physicians and employees so physicians and other caregivers can engage the patients. So let's think about the unique roles each of us plays in this. When it comes to leaders, you have to really think about senior leaders and supervisors of this. Senior leaders have a certain unique set of areas that they are the guardians of. Mission, vision, values, standards of behavior. When we work with organizations for the first time, we've read a lot of that before we get there. And when we walk into the organization, what we're looking for is, do we see those words written up on the walls, or do we actually see them walking through the halls? And you can tell a lot about the quality of the culture driven by senior leadership, about how well those words manifest in the lived experience for all of us who enter the door. And of course, senior leaders need to provide some of the contextual things that allow us to be engaged, like compensation and benefits. I do not believe that's the biggest variable that explains employee engagement, but I'll tell you, if you're highly misaligned on comp and benefits, or as bad, if not worse, if you poorly communicate comp and benefits, then certainly you can create damage in the relationship with the employees in terms of engagement. So senior leaders have a powerful role to play in creating that context for engagement. Supervisors have a much more powerful role to play. Because you've heard the old adage, right, that we join organizations, but we leave bosses. And the key here is the relationship between supervisors and direct reports. And our healthcare flywheel that we encourage organizations to adopt, it's all about creating that sense of passion that's gone dormant in some people who chose to work with us years ago in this profession to have purposeful, worthwhile work that makes a difference in the lives of others, but has gone a little bit dim. The way you spark that up is by reconnecting that strong relationship on a personal level between employees and their supervisors. Supervisors, the two key things I'd tell you throughout all the evidence that we've read on this, first of all, remember, you can't change anyone. It is not your job to engage your team. The reason we have leaders is to achieve our mission. To do that, we need to have an engaged team. But you can't change anyone. By the way, that applies at home too, right? What you can do is create an environment that allows people to engage. And you do that through communication, frequent communication, purposeful, meaningful communication, building a personal rapport with the person, not just a distant standoff. Setting clear expectations. What we want to know is just tell me what you want me to do and keep it consistent. Giving feedback at prescribed intervals about how to do that. Giving development opportunities for our teams, both professionally, personally, financially, and making sure above all that we lead with calm, focused, positive energy. We want to work at a place that seems to have a clear vision that's executed by a known evidence-based plan, and I have a leader who leads with calm, focused, positive energy. For employees, what I'd ask you to do is remember to own your own engagement. No one can change you but yourself. So we want to make sure that you're having opportunities in the organization to reconnect with why you chose that role or that organization in the first place. We all want to have purposeful, worthwhile work. We need to feel valued and involved. Work on that relationship both with supervisors and peers, but don't forget to find those opportunities to reconnect with those that you serve, because we get fired back up and re-engaged in those kind of opportunities to see the impact of our work that called us in that profession to begin with. With physicians, if you look at the various studies, there's all kind of evidence, some of which conflicts, about what engages physicians as partners in the enterprise. And I'd say that it always boils down to these essential elements. Physicians want to know that the place that they're practicing medicine supports the same high quality of care that they'd want for their own loved ones, the same quality when they're not in the room as when they are in the room. Physicians want to make sure that we honor and appreciate their most valuable resource, their time. If that first case doesn't start on time in surgery, really difficult to get back on the day. There's driving back and forth between the clinic and the hospital at times. We have to make efficient use of the time. Input, the principles of lean, the Toyota model, all the contemporary business evidence would suggest that we have to have deference to frontline expertise to truly harness innovation. Who better in the healthcare organizations than those caregivers, those physicians and other caregivers who are hands-on with patients? If you're not soliciting their input, we're missing opportunities both to engage our physician colleagues and to improve the enterprise. And while it doesn't come out in as many studies, we know firsthand the power of appreciation, sincere appreciation for the impact that we can connect them back to. Physicians want open and honest communications in those partnering relationships with leaders. But the thing that trumps all of this is the opportunity to see the impact that they have on the relationships with patients. And so if you think about this, we create this really amazing virtuous loop. One of the ways that we engage patients is by having caregivers who opt in to share and champion wins in the rest of the patients. And likewise, that re-engages the caregiver when they see the impact that they've been able to have. The key drivers of patient engagement are frankly emerging in the literature now. We know very clearly what drives satisfaction, very clearly what drives experience of patients, but engagement is just being measured through things like Judith Hibbert's work on PAM scores, patient activation measure. What she's found is that some of the key domains here of organizations where they're actually helping to improve the level of engagement of patients and the concomitant care outcomes is that those caregivers really leverage the empathic skills, individualizing the care, empowering and partnering with patients, celebrating progress together, demonstrating expertise both through their words and actions. So there's so much rich opportunity to create that engaged playing field with our partners. And finally, we all have the opportunity to be patients and caregivers. And I'd ask you to reflect upon what role we can all play. If you can't engage somebody, you can only engage yourself. You might think about what we can do to take charge of our own health, to speak up, to stay informed, to not simply accept the course of care, but participate in making those decisions. We all have a role to play.